Erectile Dysfunction Treatment, Myths versus Facts. Hey everyone! Today we're tackling a topic that millions of men wonder about but often feel too embarrassed to ask. Erectile dysfunction treatment and the myths surrounding ED medications. Here's a shocking statistic for you. Studies show that over 30 million American men experience erectile dysfunction, yet less than 25% actually seek treatment. Why? It's largely due to misinformation and stigma. Just last week in my clinic, I met with John, a 45-year-old patient who nervously asked, "Doc, are ED pills addictive? Will I have to take them forever?" The concern in his voice told me he'd been wrestling with these questions for months, maybe even years. John's worries are incredibly common. So today, I'm going to debunk the top 5 myths about erectile dysfunction medications, share real patient success stories, and give you the facts you need to make informed decisions about your health. By the end of this video, you'll know exactly what's true and what's just fear-mongering when it comes to ED treatment. Let's dive in. Let's start with the first myth. ED pills are addictive and you'll become dependent on them. This is completely false. Medical fact: erectile dysfunction medications have 0 addictive properties. Many men worry that once they start taking Viagra, Cialis, or Levitra, they'll become psychologically or physically dependent. But here's the science. These medications are called PDE5 inhibitors, and they work by relaxing blood vessels to improve blood flow. They don't affect your brain's reward system or create chemical dependency. They're more like blood pressure medication or diabetes medication. Think of it this way: if you wear glasses to see better, are you addicted to them? Of course not. You're using a tool to improve function. ED medications work the same way. Many of my patients have actually stopped using the medication after addressing underlying health issues or making lifestyle changes. When I explained this to John, his relief was immediate and visible. Now, let's tackle the second myth. Young men shouldn't take ED medications. This is another dangerous misconception. Age doesn't determine who can safely use ED treatments. I recently treated Michael, a 38-year-old software engineer who asked, "Am I too young for this?" The reality is that erectile dysfunction affects men of all ages. In fact, studies show that about 26% of men under 40 experience ED. The causes in younger men often include high stress levels, poor sleep, smoking, excessive drinking, diabetes, cardiovascular disease, or medication side effects. The modern lifestyle, with its 60-hour workweeks, chronic stress, and sedentary habits, has actually increased ED rates among younger men. Michael's case was primarily stress-related from his demanding job and irregular sleep schedule. After starting treatment and making lifestyle changes, he regained normal function within 6 months. Early treatment actually prevents psychological trauma and maintains quality of life. The third myth is particularly dangerous. ED medications are bad for your heart. This is one of the most dangerous myths out there, and it's keeping men from getting help they need. Here's the irony. Erectile dysfunction medications can actually benefit your cardiovascular health. These drugs improve blood flow by relaxing blood vessels, the same mechanism that helps your heart. In fact, Viagra was originally developed as a heart medication before its ED benefits were discovered. However, there is one critical exception. If you're taking nitrate medications for chest pain, like nitroglycerin, you absolutely cannot combine them with ED medications. This combination can cause a dangerous drop in blood pressure. Robert, a 60-year-old patient with high blood pressure and diabetes, was initially worried about taking ED medication. After consulting with his cardiologist, he safely started treatment and successfully restored his intimate relationship. He later told me, I wish I hadn't waited so long to ask. Moving on to the fourth myth. One pill will keep you erect all day. This misconception comes from movies and exaggerated stories, but it's not how these medications work. ED medications only work when you're sexually aroused. You don't just pop a pill and walk around with an erection all day. The medication needs sexual stimulation to be effective. It enhances your natural response. It doesn't create an artificial one. Here's the timeline. Viagra and Levitra typically last 4-6 hours in your system, while Cialis can last up to 36 hours. But this doesn't mean you'll have an erection for that entire time. It means the medication is available to work if and when you need it. If you ever experience an erection lasting more than 4 hours, called priapism, that's a medical emergency, and you need to get to the ER immediately. But this is extremely rare when medications are used properly. Fifth and final myth we need to address. The side effects are severe and dangerous. This fear keeps many men from seeking treatment, but the reality is much less scary. Let me give you the actual numbers. Headaches occur in about 15% of users, facial flushing in 10%, and indigestion in 7%. Most side effects are mild and temporary, usually disappearing within 2-3 hours. Some men experience nasal congestion or muscle aches, but again, these are typically mild and short-lived. Most side effects actually decrease over time as your body adjusts to the medication. Serious side effects like vision or hearing problems are reported in less than 0.01% of cases. When prescribed by a doctor and used properly, these medications have an excellent safety profile. Now that we've busted those myths, let's talk about the different types of ED medications available in the U.S. The 3 main FDA-approved oral medications are: first, Sildenafil, commonly known as Viagra. This was the first ED medication on the market. It works for 4-6 hours and should ideally be taken on an empty stomach for best results. Food, especially fatty meals, can delay its effectiveness. Second, Vardenafil or Levitra. This works similarly to Viagra but may act slightly faster. It also lasts about 4-6 hours. Third, Tadalafil, known as Cialis. This is often called the weekend pill because it can last up to 36 hours. The big advantage is that food doesn't significantly affect its absorption, so you can take it with or without meals. Also a daily low-dose version of Cialis for men who prefer spontaneity without planning ahead. Each medication has its pros and cons, and what works best varies from person to person. Here are the critical safety guidelines you absolutely need to know. First, never combine ED medications with alcohol. Both lower blood pressure, and together they can cause dangerous drops. Plus, alcohol itself impairs erectile function, so you're working against yourself. Second, avoid grapefruit and grapefruit juice. Grapefruit contains compounds that interfere with how your liver processes these medications, potentially increasing side effects. Third, always inform your doctor about other medications you're taking. Blood pressure medications, antidepressants, and antifungal drugs can all interact with ED treatments. Fourth, never adjust your dosage on your own. Don't double up because you think the effect is weak, and don't cut pills in half because you experience side effects. Work with your doctor to find the right dose for you. Fifth, buy only from licensed pharmacies. The internet is full of counterfeit ED medications that can contain dangerous substances like heavy metals or incorrect dosages. While medications are highly effective, there are also natural ways to support erectile function. Regular aerobic exercise is crucial. Studies show that 30 minutes of walking daily can reduce ED by 41%. Exercise improves blood flow, reduces stress, and boosts testosterone levels. Swimming, cycling, and running are all excellent choices. Kegel exercises strengthen your pelvic floor muscles, which play a key role in maintaining erections. It's the same muscle you use to stop urination midstream. Try contracting these muscles for 3 seconds, then releasing for 3 seconds, and repeat 10-15 times, 3 times daily. Quality sleep is essential because about 70% of your testosterone is produced during sleep. Aim for 7-8 hours of quality sleep nightly. Poor sleep doesn't just make you tired, it directly impacts your sexual function. Stress management through meditation, yoga, or hobbies can significantly improve erectile function. Chronic stress increases cortisol, which suppresses testosterone production. Even 10 minutes of daily meditation can make a difference. Let me share another success story. David, a 52-year-old accountant, developed ED after being diagnosed with diabetes. Initially, he thought it was just getting older and ignored the problem. But as his relationship with his wife became strained, depression set in. After starting treatment, David said his life completely changed. Not only did his intimate relationship improve, but his confidence returned, and he became more motivated to manage his diabetes. He's now exercising regularly, eating better, and his blood sugar levels are the best they've been in years. David's story illustrates an important point. Treating ED often leads to overall health improvements because it motivates men to take better care of themselves. Here are my 4 key recommendations for successful ED treatment. First, see a healthcare provider who specializes in men's health or urology. ED can be caused by vascular, neurological, hormonal, or psychological factors, often a combination. Proper diagnosis leads to effective treatment. Don't just go to any doctor, find someone who understands male sexual health. Second, be completely honest about your medical history. This includes all medications, supplements, recreational drug use, and lifestyle factors. I know it can be embarrassing, but your doctor needs the full picture to prescribe safely and effectively. Third, involve your partner in the conversation when appropriate. ED affects relationships, not just individuals. Open communication and mutual support significantly improve treatment outcomes. Many couples find that addressing ED together actually strengthens their relationship. Fourth, be patient with the process. Finding the right medication and dosage might take some trial and adjustment. Some men respond better to one medication than another. Lifestyle changes also take time to show results. Don't give up if the first approach doesn't work perfectly. Erectile dysfunction is not a character flaw, a sign of aging you have to accept, or something to be ashamed of. It's a common medical condition with highly effective treatments available. The statistics tell the story. ED affects over 30 million American men, but effective treatment is available for the vast majority of cases. Modern medications are safe, effective, and well tolerated when used properly under medical supervision. Remember John from the beginning of this video? 3 months after starting treatment, he told me, "I wish I hadn't waited so long. My relationship is stronger than ever, and I feel like myself again." His transformation wasn't just physical, it was emotional and psychological too. Your intimate health affects every aspect of your life, your confidence, your relationships, your overall well-being, even your professional performance. Don't let myths and misinformation keep you from getting the help you deserve. If this video helped you understand ED treatment better, please give it a thumbs up and subscribe for more men's health content. Hit that notification bell so you don't miss our upcoming videos. And remember, if you're experiencing ED, don't suffer in silence. Talk to a healthcare provider today. Thanks for watching, and I'll see you in the next video where we'll discuss testosterone therapy myths and facts. Until then, take care of yourselves, guys.